Welcome to Health or Consequences. This is the monthly Massachusetts Health Policy podcast of CommonWealth Beacon. I'm your host, John McDonough from the Harvard Chan School of Public Health in Boston, joined by my co-host, Paul Hattis from the Lown Institute. We're delighted to have you with us today, and we're especially happy to welcome back Audrey Gasteier, who is the Executive Director of the Massachusetts Health Connector, which is the health exchange or marketplace for Massachusetts as part of the Affordable Care Act. Audrey was with us about 2.5 years ago when around the time she became executive director. And we're back now because there is a crisis. This is a serious, significant crisis, not just in Massachusetts, but in all 50 states. And we're going to talk about the connector, where it's at, and particularly about the crisis. So welcome, Audrey. Thanks for joining us.
Thank you so much for having me on. It's great to be back.
So for folks who forgot your first appearance with us, could you just give us a little bit of your background? How does somebody become the executive director of the Massachusetts Health Connector?
Sure. So yes, Audrey Gasteier, I'm executive director here at the Health Connector. I have been executive director since March 2023. I have been at the Connector continuously since 2012, but I actually had my first experience at the Health Connector way back in 2007, which was really the Health Connector's first year of operations. And I was actually an intern here while I was in graduate school studying health policy. So it was a really exciting time. I got incredible exposure and proximity to those very early days of Massachusetts health reform, of Chapter 58 implementation, and just had great proximity to the ambitions of the state that was trying to decide to do something that no other state in the country had failed to do, which was really try to connect everybody to health coverage. So that was really electrifying to me as someone who cared so deeply about access to healthcare from a social justice perspective, and someone who wanted to believe we could choose as a society to say, you know, this kind of security, the security that comes with health coverage is going to just be a part of being a person who lives in Massachusetts or lives in the United States. So my career has really been focused on health coverage policy. I served as chief of policy and strategy here at the Health Connector prior to becoming executive director. I also had a stint over at the Division of Healthcare Finance and Policy, which is now known as CHIA, before coming back to the Connector in 2012. So all in, I've had about 19 years or so of work in state and federal health reform and coverage expansion work. So each chapter along the way through those 19 years has been unique. It's always been interesting, maybe more so, never more so than now with the challenges and headwinds we're facing.
So could you tell us a little bit? So we know the Connector has been around since 2006, 2007, and it's gone through phases. It's gone through ups. It went in 2013 and 14 into a massive down. Some people thought it might not survive. It recovered from that and grew back to a good position. And then since 2021, it has been exploding with good news. It's really reached a new level. So can you talk about where the Connector is right now, what it particularly does well, why it matters, why it's important, and how we got to this place where we are right now, which is a crisis?
So I always like to start with a little bit of context setting on what a health insurance marketplace or exchange is. I know most of your listeners know, but I think it's really important to level set the whole purpose of an exchange, both the Health Connector when it was created back under Romney Care or Chapter 58 or whatever term one likes to choose. But the idea was that there would be one destination where anybody who didn't already have some kind of way of accessing health coverage, whether it was through a job or through another program like Medicaid or Medicare or the VA, would have a place to come where they could choose from already vetted, kind of safe for use health coverage products. And it would be also this place that would help you pay for it if you needed help paying for it and affording it. So that's what we're here to do. That was the model that was exported through the Affordable Care Act across the country. So there's a marketplace in all 50 states. About 22 states run their own marketplaces, but the other states lean on the federal government for that marketplace function. So we are the oldest, longest running marketplace in the country. And a big part, as I mentioned, of what we do is connect people to financial assistance so that they can afford their health coverage. In many ways, that seems self-evident why that would be important to help people afford their coverage. It obviously matters a lot for that individual person who's given a hand so that they can afford their monthly premiums and afford to go to the doctor and access care, get prescription drugs. And that's what we've been doing in Massachusetts through, was first our CommonWealth Care program, then called our Connector Care program. But those subsidies and that financial assistance is an essential ingredient to how successful Massachusetts has been in expanding coverage. We have the highest rate of health coverage in the country, 97, 98%. I get asked all the time by leaders in other states and on the national scene, what is the secret sauce in Massachusetts? How did you all do it? And there's a whole array of ingredients. A lot of it had to do with the nature of the kind of political moment in Massachusetts and our stakeholder community, and lots of kind of bedfellows coming together to make that work. We have interesting policy tools like an individual mandate. We do really good outreach and engagement work. But the most vital ingredient at the end of the day is unequivocally the help we provide to people so they can afford that coverage. It matters to those people. It matters so they can get in. It matters so they're not making dire trade-offs with other household essentials. And it also plays a really important role in keeping the risk pool in the insurance market healthy. Because if you don't make coverage really affordable for people, the people who say, you know what, never mind, I'm going to hedge my bets, tend to be the younger, healthier people. So in Massachusetts, we really cracked the code for how vital generous financial support to afford health coverage is. I share that because it's an important precursor to what happened nationally in 2021. So Massachusetts always had these more generous subsidies in play, and that was a vital kind of chief part of our success. In 2021, after Biden took office, the Congress passed the American Rescue Plan. It was signed into law by the president, I think March 2021. And that included a real turbocharging of Affordable Care Act subsidies to, in fact, look a lot more like what we'd had in Massachusetts this whole time. And what that did, starting in 2021, and it was first put into law for 2 years, and then it was later extended by the Inflation Reduction Act, it made coverage across the whole country much more affordable by making it look more like what we had here in Massachusetts. So what did that do nationally? It just about doubled the number of people in Affordable Care Act marketplace coverage. It did exactly what we thought it would do. It did for the country what we'd been doing here for ourselves in Massachusetts all those years. So very impactful. I can kind of get into the wonky details if it's helpful, but the term of art is enhanced premium tax credits because it did enhance the Affordable Care Act tax credits, which are the primary subsidy to help make coverage affordable. It enhanced those in two key ways. One was it allowed people who already got them to have a more generous version of a subsidy, and it also removed the income cap for people so that moderate income people and people just over what had previously been what was called a cliff to qualify for tax credits. Previously, kind of baseline Affordable Care Act was capped at 400% of the federal poverty level. And this said, no matter what your income is, if you're required to kick in more than 8.5% of your household income towards a benchmark plan in your area, the federal government is going to come step in and help make up the difference so you don't have to kick in more than 8.5% of your household income. So it was a game changer, and it turbocharged ACA enrollment across the entire country.
Audrey, first let me add my words of welcome as we jump into exploring the details of sort of the challenge in front of us right now. We're sitting here October 23rd, where right now the law that's on the books of Congress would make those enhanced premium subsidies that you just noted go away after December 31st, unless Congress acts. And the government's in shutdown right now, and one can read in the paper or listen to the media to hear that the Democratic Party's main objection to agreeing to reopen the government is in fact that nothing has happened to renew some or all of these enhanced subsidies. So the set of issues I want to explore with you is, first of all, maybe even by example, how important in Massachusetts is maintaining some system of these enhanced subsidies. We don't know even if there's a deal to be made, which will it will remain in place now, or will some aspects of it change? Who would be most harmed? And then I want to talk to you about, with this uncertainty, about how do you communicate and go to the market with pricing and information for people to make choices. Okay. So let me start by first, if you would, talk a little bit how the enhanced subsidies play out here in Massachusetts, and maybe give us an example of who might be most harmed if, for example, they disappear completely.
Absolutely. So I'll start kind of big picture in terms of total impact to Massachusetts, and then I'll kind of wind my way towards more of the particulars in terms of who will really feel this and how this is all getting operationalized on the ground. So big picture, we're talking about $425 million of federal support that is coming in annually to the state in the way of enhanced premium tax credits. And when I say $425 million, I'm talking about the delta between what sort of baseline core ACA subsidies would have been and what they are as a result of the enhanced premium tax credits. So when we look at 2026, it's $425 million of federal support on the line to help hundreds of thousands of people who get their coverage through the Health Connector afford that coverage. So if Congress doesn't take action to extend these, that's several hundred millions of dollars just evaporating out of thin air for Massachusetts residents to help afford their coverage. So in Massachusetts, I noted that we have our special state subsidy program called Connector Care. So the way that the impacts of expiration of enhanced premium tax credits will play out in Massachusetts if nothing happens through Congress looks a little bit different than it does in other states, where it's this sort of one-to-one trade-off of, like, for every reduced dollar of federal tax credits, that's one less dollar of subsidy people get. There is this sort of wrapper through our state subsidy program, Connector Care, that will buffer some people from those impacts. But I want to be very clear. Of the almost 400,000 people we cover in health coverage, 337,000 of them will experience a premium increase just as a result of the enhanced premium tax credits going away. So it's just about everybody we cover is going to feel this in some way, shape, or form. Of the $425 million we're talking about here, about 170 million of it would be shifted to individual enrollees through the Health Connector. So it's big dollars, it's big impact. The rest of it would essentially be an impact to the state budget, of course, at a time when our state budget is experiencing a lot of strain. So 337,000 people here that we cover who will feel these impacts. About 26,000 of those individuals would no longer get any tax credit at all. So those are the people, that we think of who are sort of more moderate income, who were getting no help before. That help evaporates overnight. When we think about the people in this group that will be experiencing the starkest impacts, think about folks who are on the older side, and because premiums can be, we charge higher premiums to people who are older for actuarial reasons. The loss of those tax credits will create an exposure for those individuals that will be very, very difficult for folks to absorb. It's also the case that the way tax credits are designed, they're designed to ebb and flow with what's going on in the insurance market where you live and for who you are, age or region or otherwise. And so for people in our state who live in areas where there's less competition and therefore premiums are higher, think about the Cape and the Islands, for example. People there who will be sort of nakedly exposed to their premiums suddenly after these several years of having enhanced premium tax credits there to buffer those market dynamics, they will be feeling extremely stark increases that we know for many people will not be bearable.
Can you give us a sense of the magnitude of that, if you would?
Sure. I mean, so the average tax credit loss across the state is about $1,300 a year. But there are folks that is going to be, much, much higher, $10,000, $20,000, again, depending on age and where they live for an individual or a couple. And for most of these folks we're talking about, these are working class people. These are middle class families. Most people don't have an extra $20,000 sitting around under a couch cushion to continue to afford their health coverage so that they can continue to access health care.
Okay. And how are you going to communicate? In other words, there's uncertainty right now. You've got to go, I think, in a week by November 1st or so on the website and explain to people that they can still buy these plans, and you're going to have to quote some sort of price for it at this point. What's going to happen? Right.
So open enrollment starts around the country on November 1st, and that's true right here in Massachusetts. There's actually one state, Idaho, that goes early. They open on October 15th, but for the whole country, November 1st is the red letter date. And it's also the case that for marketplaces, the operational preparations for open enrollment start a whole lot earlier. They actually start months prior, right, with loading rates and starting to run preliminary eligibility on all of their enrollees based on the latest information they have about your household size and your income, et cetera. So all of those processes have been in place. We, with the rest of the state marketplaces, have been activating all year, trying to get attention from Congress and others to resolve this issue much earlier in the year so that we could have had a smooth kind of on-ramp to open enrollment. Of course, that's not where we are today. So where we are today, we are just days out from the beginning of open enrollment. And the letter of the law, of course, is that these tax credits expire. And we don't have the luxury of planning for a hypothetical open enrollment or, the hope or the chance open enrollment. We have to deal with the reality in front of us. So right now, there are notices going out all across the Commonwealth to hundreds of thousands of people. They've started over the last week. They will continue throughout the next week, letting people know about changes in their eligibility for tax credits and about their premiums for the upcoming plan year. So we know that those are going to be eye-popping notices for a lot of individuals. We have done a lot of work to intensify, clarify those communications so people understand what's happening, that they understand it's a result of federal law and federal policy making. We've done a lot of work with our call center, our navigators, our assisters, and others to make sure that the whole spectrum of customer service and folks who work with individuals on the ground around their coverage and their applications, et cetera, are ready for the questions, the worry, that they will be having to walk people through. So that's all happening right now. So in many ways, the kind of cat is out of the bag. That being said, we're taking pains in our dialogue with congressional staff and others to make sure it's clear that if something were to change and Congress were to take action, we would turn on a dime to get that help to people as soon as humanly possible. So we have contingency plans kind of on a shelf ready to go if something does happen and Congress comes through with an extension. But it is the case that the gears are in motion. People are being told about these coming changes that are a reflection of current law as it exists today.
John.
So forgive me for suggesting this, but there's actually a piece of good news about this whole dispute, which is that people are paying attention to this who didn't even really know it existed or there was any threat to be had anywhere. But we have heard from Republican leader Speaker Johnson, Majority Leader Thune, suggesting, oh, yes, we want to keep it going, but we have to deal with fraud and abuse and make other changes. So they want to do things like put a cap on who can get help from the program. So nobody above, say, 4 times the federal poverty level gets any premium support. They want to have everybody pay some premium, even if it's like $5 a person, so that they won't be fraudulent enrollees through insurance brokers. They want to cap the payments for everyone at a tougher level. Do any of these things make sense to you? And how do you read these reactions that have been coming out just within the past few weeks?
Sure. So I would say, at this point, we're so late in the game as we get ready for open enrollment that the idea of starting to, negotiate these types of modifications feels kind of past the buzzer in a lot of ways. I noted that marketplaces stand ready to implement anything that Congress does that extends help. So, of course, that's our mantra. That's our North Star. Any types of modifications would, of course, add time, complexity, and cost to the way we could implement some kind of help for 2026. I would say on the merits of the policy modifications that you just noted, these tax credits did exactly what they were designed to do. And so I question some of the kind of assumptions baked into some of those, particularly around, allegations of fraud and the rest. Because what these tax credits were designed to do was to make coverage affordable, to draw more people into coverage, and to create a more sustainable, stable risk pool and insurance coverage landscape. And that's exactly what they did. With respect to some of the allegations of, fraud or the rest, the conflation between any issues like that, which I would just note have only been documented to be occurring in states that are administered by the federal marketplace. The conflation of those issues, which all have to do with broker activity, I think is bad faith. And here's why. The enhanced premium tax credits exist in all 50 states. And the fact that those issues are only occurring in states that the federal marketplace oversees and have to do with broker activity suggests it's a broker issue in federal marketplace states. It doesn't have to do with enhanced premium tax credits. Otherwise, we would have seen those issues in all 50 states. So to me, that's not sensible policy making. And again, I just go back to the fact that these tax credits did exactly what they were designed to do and exactly what's needed if we're going to be a country that says we care about health coverage and we care about people's financial security and access to health care.
Thanks. And then a question about another controversy around immigrant coverage for immigrants. Some people are charging, undocumented immigrants are getting subsidies or getting coverage through this. But the other thing is that the changes that are being created are actually losing coverage for documented immigrants as well, as we understand it. Can you clarify what's happening in terms of the immigrant populations right now?
Absolutely. So I will confess to deep confusion when we started to hear talking points out of the White House and elsewhere about the idea of undocumented immigrants being covered through marketplaces or the Affordable Care Act. Not only is it the case that undocumented immigrants and folks who are not residing lawfully in the United States, not only is it the case that they can't access Affordable Care Act subsidies, they can't even buy coverage on their own with every cent paid for by themselves through ACA marketplaces. That's part of federal statute. The moment that somebody applies for coverage through a marketplace in any 50 states in the United States, their residency, their lawful residency, is checked and verified by the United States Department of Homeland Security. So there's a lot of checks and balances here. So in short, this is not occurring. It's not occurring for subsidies. It's not even occurring for unsubsidized coverage. So that is a false talking point. I would also note that in the so-called One Big Beautiful Bill Act, we saw a provision come through there that will rescind financial assistance through marketplaces for lawfully present immigrants, that's lawful with an L, individuals who are covered through marketplaces like the Health Connector who are below the poverty level. So it's essentially going after a population that is as low income as you can get and are immigrants who've come here legally, exactly the way we ask them to. So here in Massachusetts, of course, we're getting ready for all sorts of headwinds and setbacks through the so-called One Big Beautiful Bill Act that will hit both our Medicaid program, Mass Health, as well as the Health Connector, our marketplace. We have the unfortunate distinction at the Health Connector being the first program to take one of the hits out of that law. We will in January have about 37,000 people that will fall out of eligibility for our Connector Care program as a result of the so-called One Big Beautiful Bill Act and the rescission of those folks' eligibility for ACA tax credits, since that's a precondition for being in Connector Care. So it's obviously deeply concerning about the impact to those individuals who will have the health safety net and other ways that they can access care. But of course, it's not the gold standard of health coverage that we've so long valued in Massachusetts. And I would also note, in addition to the harms to those 37,000 or so individuals who, again, lawfully present folks here in Massachusetts, the folks who are our immigrant populations who are insured are among the healthiest people in our state. They're the youngest. They tend to use the least healthcare resources. And so their removal from the health insurance market, we're all going to feel that, not just because we'll be paying when they do show up in the emergency room or community health centers for care, but we'll be paying higher premiums because some of the healthier people that have been offsetting some of our older, sicker folks that we cover and need to keep covering, we won't have that same balance in the risk pool. So there's all sorts of downstream effects that come out of this policy making that we're really trying to help folks understand and wrap their heads around.
Audrey, as we sort of finish up this topic, I wonder if you could put your consumer advisor hat on in this way. So open enrollment starts November 1 and runs to some date in December. And you're somebody who is going to been buying on the exchange and wants to continue buying, when they buy a plan, if somehow something happens in Congress that there's price improvement, I assume if they bought that plan before price improvement, they'll get that improved. In essence, the subsidy will kick in for them. And is there any reason for people to wait rather than purchase right after November 1, but wait to see what happens in Congress? What would you say about those two issues?
That's a great question. So we would encourage people, certainly at a baseline, to be paying attention. So we've sent out these notices. We're in touch with people about what's happening. The good news is actually in Massachusetts, our open enrollment period runs until January 23rd. So people have a little bit of extra time. I'll put a little asterisk next to that. That's something we've done through state flexibility over the years, is actually set our own open enrollment dates. And we've always preferred in Massachusetts to run a longer open enrollment period. It just gives us more time to be in touch with people and let people take the actions they need. The federal government, CMS, actually recently finalized a rule that will take that flexibility away from states starting next year. So we're still, this open enrollment period, we have this ability. We've long used January 23rd as our end date. So we'll cross that bridge next year when we move into a period when that state autonomy is being taken away from us. But for this year, we do have a little bit of extra time. So that's important for people to understand. I wouldn't suggest to people that they wait. So if they want to come in and start exploring their plan choices and, checking provider networks and the rest, they should do that. But they don't actually have to pick a plan and make a payment to effectuate their coverage that starts January 1st until December 23rd. So there are several more weeks where if things do change and subsidy eligibility changes or the rest, we will be in touch with people right away so that they know that and they can take that into account as they're making decisions about their coverage starting in January. So I think my big takeaway to people would be, or my big message to people would be paying attention, be in touch with us. We're sending out all sorts of resources. We have a special link on our webpage. It's mahealthconnector.org/updates, where we're keeping people posted about what's happening. People should feel free to call us. They should get in touch with navigators. We have a whole spectrum of supports ready to assist people through what is a really dynamic and uncertain open enrollment period, much more so than we'd like to see. But it's our job to bring calm and certainty where we can and make sure we have the backs of the people here in the Commonwealth that we serve. And we are ready to do that. So we want people to be paying attention, taking action, and be in touch with us so that we can support you.
Okay, one more question from me, Audrey. It's about the cost of healthcare and small business. So we just have seen data across the country that the price of family coverage, a family policy for a year, is now equal to buying a brand new car every year. Just extraordinary. And small business, we've been hearing for years, has just been crushed under the burden of these, both the workers and the employers supporting them. We know that this has been a priority for the connector, but can you tell us where it's at right now? Is there any reason for a small employer to continue to provide health insurance? Shouldn't they just send them all to the connector? How do you advise people to deal with this really disturbing situation in the small business market?
It is disturbing, and I appreciate you bringing that up and just sort of making visible what I think can seem invisible to people. What we know the consequences of that unbridled cost growth are, in reduced wages and all these things we may not see, even if we're still paying that additional premium and cost sharing as employees. So I answer this in two ways. I see the Health Connector's role with respect to small businesses and employers in general as we're here to provide the kind of coverage that you want to provide or connect people to. We have our individual market, which is how most people know us, and that's where most of our enrollment is. About 400,000 folks across Massachusetts get their individual coverage through us, and most of those people are employees of businesses, whether they're small businesses or large businesses. So we're doing more work to try to think about how we can connect businesses to the individual market, and making sure that they have supports and information to provide their employees about why Health Connector coverage may make sense for them. There's all sorts of interesting policy dialogue happening about things like ICRAs and different tools that maybe in the future can allow an employer to pair a contribution with an individual market policy, if that might make sense for them. So I think there's a lot of kind of fruitful spaces that marketplaces can be a solution to employers of all sizes, frankly, in being a destination for benefits that, frankly, can be pretty portable for people, which I think has its own virtues. On the small business side, with respect to kind of explicitly small group coverage, the Health Connector has a program called Health Connector for Business that offers small group coverage to small employers here in Massachusetts. That's employers with under 50 workers. And we offer a few different models for how employers can do that. And we are starting to see some uptick in interest among small businesses. And the reason is because we offer something different than they can get anywhere else in the market. And that is the employer can come to the Health Connector and set a benchmark plan, but also allow their employees to shop from a whole different array of carriers. And that allows the employer to kind of be out of the business of picking the perfect plan for their 20 or 30 workers, which doesn't sound fun for anybody, I think, just knowing about all the different preferences employees might have. And it gives some predictability and cost to the employer. So that's something we're seeing growth around, and we're working with the small business community and brokers to make sure small employers understand that option. But I see us as really wanting to provide, our kind of North Star is how do we provide a spectrum of options for small employers, whether it's because they want to offer group coverage for competitive reasons. Hey, we've got a great way for you to do that we think beats the market in a lot of ways. But if you don't want to be in this business, that's okay too. And we'll take care of your employees on the individual market side. We want to make sure everybody's got coverage, whatever avenue the employer wants to make available.
Finally, Audrey, we're going to ask you to end our discussion with your futurist hat on. In this way, you've been at the Connector, as you said, from 2007 and experienced its highs and lows. But imagine somehow we get to January 2029 and we have Democratic control of the White House and possibly the Senate or the House, or at least one of those chambers. And now there's an effort afoot to reverse some of the policy changes that seem to be moving in place now. We don't know, obviously, for sure what's going to happen. Can damages that happen between now and then be reversed, would you say?
So I'm a glass half full person. So I am choosing to believe that the answer to that question is yes. And I would just say, with respect to Massachusetts's role in that, being in this space for nearly 20 years and seeing the highs and lows, this is a unique moment. I'm not comparing it to past chapters, but I have seen Massachusetts lead under every type of circumstance you could fathom when it comes to public policy and health policy specifically. We lead when we have, the winds of the federal government and its support at our back. We lead when we're facing headwinds from the federal government and they're walking away from the same principles that we've, previously shared. So I'm looking forward to a moment when we can move through these headwinds. We are rolling up our sleeves in Massachusetts. We are not facing this without a fight. We're going to fight for the healthcare and the integrity and the dignity of all of the people that we care so much about here in our amazing state, in terms of their healthcare, their financial security, and their general dignity as residents. So we are in that fight now. I think weathering the next few years, you will see Massachusetts's leadership on that. And then once we get to, the shore on the other side of this, I think it is absolutely the case that in health policy, sometimes it is 3 steps forward, 2 steps back, and you just have to keep moving. And I think it's our job to be thinking right now about what are those next 3 steps forward. And I would imagine that would involve restoration of a lot of these important supports that are getting stripped away, but hopefully also building something better too, not just kind of going ping-ponging back and forth between political party control and, building and rebuilding the same thing. Hopefully we can take things even further. And I think in a lot of ways that was reflected in the enhanced premium tax credits. That wasn't just about kind of getting the ACA back to baseline post the first Trump administration. It was about moving the Affordable Care Act even further. So I think, it will be very important that everyone is ready with their creative, ambitious thinking when the stars align and we have that opportunity. And I'm excited for Massachusetts to be in the center of that.
So Audrey Gasteier, Executive Director, Massachusetts Health Connector, thank you so much for joining. And just by the way, congratulations and best wishes to your outstanding staff at the Connector. You have a marvelous, terrific team, and we're lucky in this moment of crisis to have you and your very able staff working so hard on this. So good luck in these challenging days ahead. And on behalf of my colleague Paul Hattis and I, thanks for joining us for this podcast. We'll be back again next month.
Thank you.